Real Country 1430 AM and 1073 FM WRDN. I'm Brian Winnekins. Joining us this morning, Angela Jacobson. She is Director of Emergency Preparedness with Advent Health. And today we are going to talk a little bit about a recent study or survey from the March of Dimes that said Pepin County is a maternity care desert. And Angela, thanks for joining us this morning. I was surprised when I saw that they said we were a maternity care desert when we have the hospital here in Durand. I'm sure the hospital was just as surprised.
We were. We have two providers, one in each clinic, Angela and Jane, that both do maternal care up to 28 weeks. We also have ultrasound here 3 days a week. And we have an OB/GYN, Dr. Crow, who comes every month.
And so, has the hospital tried to reach out to the March of Dimes to kind of get a little bit more clarification of why they listed us as because it sounds to me like Durand is going to have more than Menominee here in the near future because they're moving all of their stuff to Eau Claire.
Most rural hospitals, to keep labor and delivery, it's harder to keep labor and delivery and to keep those nurses and doctors trained than to keep it in-house because of the extensive training that needs to go in and the hours that need to do it. You also would have to have a surgeon 24/7 on call in case you have to do a C-section. So it becomes a bigger liability to keep it in these small hospitals than to pass it on.
Okay. And that is obviously then that's a challenge for some of the rural hospitals. Are there other challenges that the rural hospitals have to try to keep this service along with the training? Because I'm assuming that there might not be as much demand in the rural areas, or am I mistaken on that?
We used our OB, we used to have Dr. Longbella. Dr. Longbella and Dr. Crow share an office in Eau Claire. And Dr. Longbella used to come here every week. His patient load dropped so bad that then he started coming every 3 weeks. Then he stopped coming altogether and Dr. Crow took over. Now he comes once a month and he still only sees 2 or 3 people here.
Wow. Okay. What are some of the other things that the hospital is doing along with still having some of these services here, but are there other things that the hospital is trying to do to keep these services in place, not only in Durand, but in some of the other rural areas that Advent Health serves?
We have 2 skills fairs twice a year in my nursing department. And for the emergency room nurses, we do practice every year with an OB nurse or review it, imminent delivery in case somebody comes in the emergency room. And we have all the kits because what do? You can't say, don't come out, baby.
I'm about to say, when it's time, it's like, well, sorry,
it's time.
We can't wait. Talking with Angela Jacobson, again, Director of Emergency Preparedness with Advent Health of Durand. Again, March of Dimes coming out with this recent survey, basically saying that Pepin County was one of only a few counties in Wisconsin that was a maternity care desert. But obviously with the services you're providing, that's really not true then.
No, we have 2 family practice nurse practitioners, like I said, so they'll see you up to 28 weeks because they won't do deliveries, but they do all the prenatal care. They do all the national testing that's required. They order the ultrasounds and review them. If they have any concerns, they work with Dr. Crow, or that mother can pick their own OB, and we will transfer all the files once it gets to closer to the delivery time, 28 weeks and above. Also, after the delivery, both of those providers will start at newborn follow-up appointments.
I was going to ask that. What about after the delivery then? So that postnatal care, if I'm not mistaken, or infant care. I mean, that's also then provided once again, so they kind of come back into play.
Yeah, they come back in so we can see what that baby looks like.
And that 2,000-mile checkup and warranty, any warranty repair work that might need to be done. Yeah. How important is telemedicine with all of this?
Telemedicine, we haven't even offered telemedicine because there's not a need. Dr. Kroll will see maybe up to 3 patients a month.
Wow. Is that something that that the hospital believes that down the road that could play more of a role with this, or is it because of the demand being so low, it'll always probably just be the way we have it right now?
Because of the demand being so low, it might just be the way. Any service that we think we need, since we already own a telemedicine machine, we could get those services here, but we have to make it worth that provider's time to take off and schedule the appointments.
Sure.
So
I
we do
know
have different providers that come Monday through Friday from Eau Claire, and they can also book other days if they're even more full.
Sure. Again, talking with Angela Jacobson, Director of Emergency Preparedness with Advent Health here in Durand. Angela, with this recent survey that March of Dimes did, what's going to be, I guess, the plan down the road, or is this something that was put in the need for prenatal care? Was that something in that recent survey from earlier this spring that the health department and the hospital kind of did together about community needs? Was that even brought up in that survey?
No, that was not brought up. It wasn't even in the top 20.
Wow. Really? Well,
Yep.
do you know about what some of the things that the community was really wanting to focus on?
Some of them were transportation.
Okay.
Some of them were, gosh, I should have had that pulled up, Brian. I know transportation was a big one.
And is it transportation
Services, which
okay.
we do. I think we need to advertise more of everything that we do here.
Sure. And was that when
access to food, I think, was a big one.
Okay. So some of the things that the hospital does, were you surprised, or were the folks from even the health department and the hospital surprised when they were getting responses back saying, well, we need this or we need that? And it's like,
you were all
always
surprised
provided that
about the need for the food.
Wow.
Because they do such a good job at the food bank. They have the Ruby Pantry. They have the church events that go on. We were really surprised that was a concern for people, that people wouldn't have enough food.
That is a surprise. Wow. Again, talking with Angela Jacobson this morning from Advent Health. Again, this recent survey from March of Dimes saying that Pepin County is a maternity care desert, which I think is kind of in question how they came up with their results. Do you know, Angela, did the hospital actually reach out to March of Dimes saying, hey, wait a minute?
No, not yet. We have to go through legal for that.
Well,
they can't just set somebody up. Blaze is going on that.
But obviously, though, that's something
Advent Health is a huge corporation.
Sure.
So, yeah, but there will be follow-up. Like, who did they ask? Who took the survey? Did you reach out to anybody at the hospitals or clinics? I mean, we are registered as a critical access hospital in the state of Wisconsin, a trauma level 4. Where did they get their information? And
that's I guess that would be the one thing, that because the hospital is that trauma care and critical level 4, that does have to include maternity, because again,
yeah,
when it starts.
Yep, it has a certain criteria for skills that you have to go through every year.
All right. Well, that's again, that's some good information to know about. Now, before we let you go, obviously we're getting into fall. We have the flu shots are going on. We getting close to the flu. We have these new COVID boosters, but how are we doing on all of that? Hospitalized, things still pretty quiet?
We are actually in a high transmission rate in our county, and I check that 3 times a week, which I was surprised about, because we are not seeing a lot of people, I mean, they're admitted with COVID. And when they do get diagnosed, I wouldn't have guessed that was COVID. So their symptoms are a lot less than in the beginning, which is very good. But we do not have a big demand for the boosters. And we did get all of our flu shots in, finally. Okay. They were on back order for a while.
Really?
We get the quadrivalent, so it covers more strains of the influenza than a lot of people do. And we always get the preservative free and everything. So
Okay. Okay. And folks should just contact their healthcare provider to make that
Yep,
appointment to
get
get
a
the
flu
shot.
Yep.
Awesome. Awesome. Well, some great advice. Well, again, Angela, we appreciate you joining us today.
Yeah, thank you.
Angela Jacobson, she is the Director of Emergency Preparedness with Advent Health of Durand. You're listening to WRDN.